Hello, welcome to our imaging panel. I'm Erin Hammond. Today we're working with our professionals throughout Northern Light Health to talk about our imaging positions, their career paths, and what they like about that. Our imaging and radiology professionals run the equipment to take pictures of the body to assist our providers in making a diagnosis for our patients. And today we're going to start with Stephen, who's going to share a little bit about his role.
Hi, my name is Steve Moon. My job is a cardiac sonographer at Northern Light Health Mercy Hospital. What I like most about my job is the autonomy of the position. As a sonographer, you are solely responsible for what the doctor sees to diagnose the patient, if you will. And the doctors place a lot of trust in you in doing that. Obviously, the income is attractive too. The job pays well right out of school or the program you finished in order to get into the job. Once you earn the trust of the physicians, cardiologists, the job from there is even better because they place a lot of trust in you for what you do. So if a patient, oftentimes we go to the floor to image patients, unlike other imaging modalities. I know X-ray does this, but we travel to patients' rooms and what have you. And when we gather that information, it's more of an interrogation of the heart, so to speak. And the doctor has to depend on that information to diagnose the patient correctly. So we come back, we actually do our own reports. The cardiologists review the reports, and then we're actually sometimes in the room when the cardiologist is asking us questions about the patient and the image and the information. And once you earn the trust of the cardiologist, I'm not sure exactly how long that takes. I've been doing this for quite some time now, so I have earned that trust. And they will certainly bounce questions off you and ask you what you think of this here. And as far as, for example, in the heart, all the stuff we see, structures, blood flow, and all of that, a lot of the information determines the filling pressures of the heart, depending on the condition the patient's in and depending on what we're looking for. So we answer all those questions for the doctor as best we can with cardiology. I really enjoy being with the patients. I learn a lot from the patients, especially as I move on in life here, and a great deal of respect for the patients and the position they're in. I find that's very important in this job. A day in my work life, a typical day, starts at the computer. We come in the morning, the patient's, orders have come in. We go through the orders. We check our patient's schedule. Some of us are in the office setting. Some of us are in the hospital setting, so the inpatient setting, that is. I do a lot of inpatients, so we organize the inpatient orders, which can be anywhere between 6 and 10 for a day, and that's one person doing the study. It's actually quite a bit of work, especially if you do a good job. We prioritize the patient orders in such a way that the doctors, whichever one is a stat, which one's more important, which one the cardiologist would like to see first, the patient has to get out of the hospital if they have another test coming up. So that can be a little bit challenging in the morning. Once we get that organized, we're off and going. While I go to the rooms on the floors, we have another one or two others that are doing echoes either in the hospital or at the MOB, the office setting. How I got into this profession, I came into this profession very late in life. I was in my 40s. I'm now in my 60s. And I was a public school teacher before this. This job requires, it's really not that bad. It requires just an associate's degree in the sciences. You can also get a bachelor's degree in the field, depending on where you want to pursue that education. I went to Southern Maine Community College, and it was a very cost-effective approach for me, where a job you can make very good money for a very low output and income, if you will, for the cost of the education. I've also taught this at Southern Maine Community College, taught echo. So that's another progression you can make if you desire to do that. So the associate's degree is the start from education And from there, you have to get registered. There are two different registering bodies in the field of echocardiography. There's ARDMS, the Association of Registered Diagnostic Medical Sonography, and there's another organization called Cardiovascular Credential International. They both have registries. You have to get registered to get a job in the field. And so you have to pass this registry exam if you've done all your clinical tests and whatnot. You can advance through the registries. And I've taken the opportunity to do that. What's called an advanced cardiac sonographer. You take a test, you challenge a test. After so many years in the business, you have to be, I think, in the business 8 years and have so much experience before you can take the test. So you can graduate up through the ranks, so to speak. And I think it's a great profession to get into. Thank you.
Great. Thank you so much, Steve. And yes, we have echo techs throughout our system. All right. So next up, we have Tiffany.
I'm Tiffany McElhern. I'm the supervisor at Northern Light Mayo in radiology. I am an X-ray and CT tech. I'm a working supervisor, so I'm on the floor daily, as well as my supervisor role. I started with Northern Light about 11 and a half years ago, and I kind of started at the bottom and worked my way up. I started as an evening tech, moved into like a mid shift and then on to day shift, and have kind of come up through the ranks, if you will. I wanted to get into radiology. I got into it right out of high school. I wanted to work in healthcare, but radiology appealed to me because it's only a 2-year program. It's an associate's degree. And then I did do my CT training on the job when I started at my facility. There is the option to do that through schooling, but a lot of times you can get the on-the-job training for that as well. A day in the life of my position is we are a small department, which I enjoy because I get to do multiple different exams throughout the day. I can be in X-ray in the morning and then doing CTs in the afternoon, or even helping out in the OR. So there's a lot of variety, which I really like. It helps keep it from getting mundane. I like most, like I said, the variety, and I also like helping patients. You know, you could have contact with 20 different patients in a day, which is nice. It's short-term patient contact, which can be more appealing than, say, with a 12-hour nursing shift. You work with the same patients for pretty much your whole shift. For education, like I mentioned already, it's an associate's degree, and then you do have to get registered. And then with that associate's degree, though, it opens up a lot of pathways. You can either go just into X-ray, or you can then branch out into the other modalities like CT, MRI, nuke med, mammo. So it's kind of the jumping off point for a lot of radiology careers.
Thank you. All right. Next up, we have Ashley.
My name's Ashley Mehurin. I'm a radiation therapist and the manager of radiation oncology at the Cancer Center in Brewer. So I've been a radiation therapist for 12 years. What I like most about my job, I really like working at Northern Light Health specifically because I love what our organization stands for. We're truly patient-centric. We give everything we have into giving the best care to our patients and their family members when they come to us looking for guidance and solutions and support. I initially started my healthcare career off in medical radiography. So I graduated Eastern Maine Community College back in 2009. During my senior year, my aunt was diagnosed with metastatic breast cancer. And so she underwent surgery and then had radiation therapy to follow. And so I attended some of her treatments with her just to get the aspect or point of view from her as to what that entailed. And it was something that I wanted to further my education in. So I graduated the radiation therapy program at Southern Maine Community College back in 2011. And during my senior year in that program, my grandmother was diagnosed with gastric and lung cancer. And so I was actually able to be a part of her treatment team and really be on the cancer journey with her from diagnosis to the end of that. So that was something that I'll always be really thankful and grateful for. So, day in the life of a radiation therapist. So we are responsible for carrying out the radiation oncologist or the physician's prescribed radiation treatment plan. So this includes operating a really big machine that's very expensive called the linear accelerator, and it delivers really concentrated doses of radiation to the target structure and also minimizes dose to surrounding healthy structures. We also treat with very high doses of radiation to small brain lesions, and we call that stereotactic radiosurgery. So essentially, it's an ablative form of treatment that does not require the patient to undergo surgery, but has some of those same results as surgery would. And we also do another type of treatment called brachytherapy, and we use a really tiny radioactive source that's about the size of a grain of rice. And we use that to deposit dose strictly to the tumor volume, while again sparing the healthy tissues around that area. So that's commonly used in the treatment of gynecologic cancers. A therapist also operates a CT scanner for treatment planning. Sometimes this requires us to administer contrast, and that really just highlights the organs that we need to see and helps the physician and our treatment planners do everything that they need to do to give the patient the best course of treatment. So radiation can be sad sometimes. We are seeing patients throughout the entire course of their journey. We're getting to know them. We see them Monday through Friday, anywhere from one treatment to 8 weeks of treatment. So we get to know their family. We have a little celebration with them at the end. And for our pediatric patients, we do try to make things as fun as we can. So I have a mask here I just wanted to show you guys really quick. I can't remember the superhero that it was, but one of our pediatric kiddos requested this. And so our radiation therapist really took on the chore to do that. So he was really excited with that in the end. And then as far as education, so same thing with radiography, we require an associate's degree at the minimum. However, if you have a degree in medical radiography, if you have your associates, we can do a fast track course. And so you can just gain a certificate in about 12 months, and then you would be eligible for a position. You do have to pass a state board certification exam, and then you would apply for a Maine state license. And the two closest schools for radiation therapy are in New Hampshire and Vermont.
Ashley, thank you so much. Next, we have Brittany.
My name is Brittany McDaniel. I'm the lead mammographer here at Inland Hospital. I've been working here at Inland. I started in X-ray for about 11 years. And I've been working in mammo for the past 9 years. I started out as just a per diem and then became full-time. The reason why I wanted to work in mammography was because it's just a very personal and rewarding career. I've worked in all parts of X-ray, from CAT scan to going to the OR, fluoro, but it's just a more personal touch that you get with the patient. It's one of the only modalities really that you get to build that connection with your patient because you see them from year to year. I have so many patients that will come in and remember me from last year when I did their mammogram, and you kind of get to know their families. They check in like, how's your son? You know, so it's a really personal connection that I'm able to build with each patient. A typical day in the life of my position, we usually do anywhere from like 20 to 30 mammograms a day. Each patient's scheduled at about 15-minute intervals. There are most of them are screening mammograms. And then we have anywhere from 4 to 6 diagnostic mammograms a day. So screening is just like a routine, basic. Patient comes in once a year for just their screening to make sure that there's nothing going on. It typically would be someone who didn't feel anything. Their physician hasn't felt anything. Diagnostic patients can come in for various reasons, whether they feel a lump, if they've noticed a skin change in their breast, if their provider, when they've gone in for their yearly exam, has felt a lump on a clinical breast exam, they would come in for some additional imaging At that point, we coordinate with the radiologist and ultrasound typically at the same time to schedule this patient. So that way they have their mammogram, they're seen, the images are reviewed by the radiologist while they're here. And then potentially they move on to ultrasound if needed afterwards. And we kind of walk the patient through that process while they're here and try to put them at ease. Because it can be a scary thing, especially if they're coming in with a problem or if they were in for a screening and then they got a call back because the radiologist saw something on the images that they needed to get a closer look at because it looked worrisome for some reason. A lot of times they are coming in and they're very nervous, they're very upset, they can, be angry just because they're scared. So part of my job is just to be able to put that patient at ease and to try to make them as comfortable as I can with the process, and just being open and honest with them along the way on what the radiologist says and what is going to happen next. We also do some biopsies here. We in mammography play a role in assisting with the pictures after the patient has had an ultrasound guided biopsy. So a lot of the times the radiologist deploys a clip, the titanium clip in the breast to mark the area. So we take imaging afterwards to make sure that the clip is in the correct place and that the radiologist is happy with where that clip was. But sometimes we work with the radiologist and we do needle localization biopsies where the patient comes in and we work with the radiologist to put a needle and then a guide wire in the breast before the patient goes to surgery that day. So typically we would build them up to day surgery afterwards, and then they have like a lumpectomy there in the OR, and then we image the specimen as well afterwards to make sure that we get all of the margins on the image. And then there's a lot of paperwork that goes into mammography. It's very detail oriented. It's very strictly regulated by the MQSA, which is the Mammography Standards and Quality Act. So there's a lot of paperwork. We have yearly inspections that it's a lot, like I said, of detail, making sure we have all of the patient's history, we have everything documented. What I like most about being in mammo is, like I said, the kind of the personal connection that I get to make with each patient. And it's also a challenging field because no two patients are alike. Some patients are harder to position than others, just depending on body habitus, if they have, limitations with their shoulders. So it can be a challenge to sometimes get those quality images, but it's always fun to be able to see that you were able to get those high quality images, even though you had a difficult patient. And just being able to help detect breast cancer early on that could potentially save somebody's life. It's just, when you're able to get that little bit of extra tissue and they're able to find something, and that could be the difference of, life or death for a patient. So I went to KVCC for X-ray for 2 years. That's how I started. And then I did on-the-job training here at Inland, which consists of doing about 100 mammograms. 25 of those are directly supervised with a registered mammo tech. And then 75 are checked images afterwards. You typically have about 2 years from when you start your training. You have 24 months to complete the process. There's a lot of education. You have to do educational credits. There's a lot of quality control that you learn. And then you have to sit for your mammography boards and pass those as well in order to be a registered mammo tech. And then once you have passed your registry and you are a mammographer, you have to keep up with it. Like I mentioned with the inspection, we are inspected as well as the radiologist, the facility. We need to make sure that we are doing at least 100 mammograms a year. and have 15 continuing education credits that are directed strictly to mammography within 3 years. And it's just a career that you have to be really compassionate and caring, because these patients come in and they are really scared. And, especially if they have a family history or it's their first time coming in for a mammogram and they've heard all these horror stories. So it's just, it's a really good career, and I love what I do.
Great, thank you. All right, next up we have Jeremy.
My name is Jeremy McCormick. I am the current supervisor here for the Nuclear Imaging and PET-CT department at Northern Light Eastern Maine Medical. I have been working here for 18 years. I did start out in X-ray, and while in X-ray and going to school, I was introduced to the nuclear world, which kind of had a draw to me. It was just unique, as a lot of these modalities are in medical imaging. Everyone has their little things that each of us like. That's why we're doing these roles. And not everyone understands them. So nuclear was defining to me. So I went to school while working in X-ray and became a nuclear tech back in 2006. And to piggyback off of everyone's kind of comment is, I think for most of us here in our roles that we're doing, even we might be supervisors or not, but it's working with the patients, it's the patient relations, the family members, to see them come in, give them hope. The innovative imaging in the nuclear world has come light years just in the past few. We work hand in hand with Ashley's group with radiation oncology and the whole CCM crew. We're able to now precisely do a specific imaging for these prostate male patients, particularly for a PSMA, which is what we call the scan. It's looking at the specific antigen that the prostate cancer gives off. So we don't look at the body, or our images aren't looking at an overview. We're looking precisely at a very unique level inside of the body to help with treatment planning, strategy, and those things. A day in the world in my realm is pretty unique. It's very diverse. We work with the radiologists. We work with the cardiologists. We do a lot of cardiac imaging. Our cardiac portion, we do a lot of SPECT CT imaging that we're looking for areas of ischemia, which are areas of the heart that's not being fed. So we look for blockages in that. On the oncology side, we do bone scans, our oncology scanner in Brewer. We do our PET CT scanning with that. We're also hand in hand with mammography and the breast center by doing advanced breast imaging for pre-op patients going into surgery to precisely pinpoint lymph nodes. Whereas it wasn't that long ago where a surgeon would go in and take as many lymph nodes out as they could find. And left these patients with a lot of edema. Recovery was pretty harsh to them. So with our precise imaging now, we're able to make recovery less, but be more precise and actually quicker. And these are all things that happen on a daily basis, and to be involved in those is what really gives you the drive and want to be part of everything that you can and stay in tune with what's coming down the pipeline. The career path I kind of touched on with mine, it was kind of interesting for me. I wanted to do one of two things that I knew of growing up, and that was I always loved the outdoors, but I knew I wanted to do something medical. So my path started me in conservation law to be a game warden. Quickly into that role, I found I didn't want to do that. So I was fortunate enough to do a job shadow in the medical imaging department, and which brought me through the X-ray and ultimately to where I am today. The program that was offered locally at the community college is still there for X-ray, but for the nuclear world, the only schooling right now currently active is the Massachusetts School of Pharmacy and Health Sciences down in Boston, and it is a remote program that we do have a partnership with for having students come up to see our area and give them just a little more diverse look at what other facilities, what their nuclear programs are like. So it is nice to be a part of that and offer that as well to students coming up through and able to host job shadows for people that are interested.
Great. Thank you, Jeremy. All right, so I think that concludes everyone. So we want to thank all our panelists and for sharing your expertise in your respective imaging modalities. If anyone is interested in learning more about imaging careers at Northern Light Health, we have 10 member hospitals throughout the system with imaging departments. You're welcome to reach out to the talent acquisition team at Northern Light Health at talent@northernlight.org or 207-973-7100. Thank you all again for taking the time to learn more about our careers today.